Hello, my name is Dr. Ronald Popper, and I'm a board-certified sleep medicine specialist and the medical director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. Today I'd like to talk to you about obstructive sleep apnea syndrome. This is a disorder in which there's both snoring and holding of the breath during sleep. The reason that this occurs is because there's obstructive tissues in the upper airway, which is between the tip of your nose and your vocal cords. Think of the airway of a patient with sleep apnea like a flimsy, thin paper straw, and the airway of a normal individual as a big, thick, rigid lead pipe. Because your airway is smaller, you have to suck harder to get air from out here past that obstruction and into your lungs. The harder you draw that air in, the more you suck those tissues closer together. Going back to the analogy of the paper straw, we all know that if you suck hard on a paper straw, the straw collapses. Now, this doesn't happen while you're awake because normally we have muscles that counteract that suction effect by pulling the airway open. But when you go to sleep, so do those muscles, so you lose that compensation. So what happens when you go to sleep? You snore, you suck harder, you collapse the airway. When you stop breathing, your oxygen level falls. Your brain doesn't like that, so it sends a signal out that tells you, wake up, start to breathe again. Now, this can happen hundreds of times throughout the night without your ever being aware of it. The end result, however, is that the quality of your sleep isn't very good, and you're going to be sleepy in the daytime. More importantly, other chemicals are released each time you awaken from sleep, and these markedly increase your risks for things like high blood pressure, heart attack, stroke, congestive heart failure, irregular heart rhythm, diabetes. Even cancer and sudden death are associated with obstructive sleep apnea. The unfortunate thing is 90% of patients with obstructive sleep apnea have yet to be diagnosed or treated. So there's this huge population of patients that urgently need to be evaluated. So do yourself a favor. If you snore, have ever been told that you stop breathing during the night, you wake up with choking or gasping, if you're overweight, or if you're a man with a neck size of over 17 inches, a woman with a neck size of over 16 inches, or have high blood pressure, see your doctor. Be evaluated for obstructive sleep apnea syndrome. See a board-certified sleep specialist at an accredited sleep center. Do yourself a favor and be evaluated. Sleep well tonight and have a better day tomorrow.